Namaste. I'm Dr. Sumitra Devi Shrestha from the technical lead from the Hill Group, Nepal. It is located in the Southeast Asia and with China, north and the boundary with the India. The country is politically divided into 77 districts, and we have selected Lamjung district for this case study. Next slide, please. And within Lamjung is selected as this is representative to the lymphatic filariasis distribution in the country, that is about 385 to 5,800 feet above sea level. And in this district, Rainas municipality is selected as study site. The region this is one of the most affected in municipality, and there is clear that if lymphatic pre-transmission assessment success in this municipality, the whole Lamjung district will pass. That means considered as non-endemic for the lymphatic filariasis disease. Next please. The rationale for pairing these two campaigns, lymphatic filariasis elimination and vitamin A supplementation campaign, is introduction guided by the National Health Policy of Nepal and national target of lymphatic filariasis elimination by 2020 is now as 8. And Nepal has been using campaign model for a long time. For example, vitamin A campaign is ongoing for 27 years, and lymphatic filariasis elimination campaigns from 2003. So within this background, we plan in this to collaborative planning of these two campaigns to maximize lymphatic filariasis campaigns impact by improving efficiency and effectiveness. So purpose of this case study is identify, support, and document approaches of collaborative campaign planning. This case study tried to aim to address 3 questions proposed by the RFP, and one of these is enabler hinder of collaborative planning in Nepal. The enabler is policy directives as country moving adopted federal system and moving towards the decentralized health system. We take it as an enabler factor. Policy is conducive for integration, and the other is comparable strategy is used. Both program mobilize female community health volunteers, and there is barriers that established programs. Both campaigns are established programs that particularly run by 2 different divisions of the Department of Health Service. And about the stakeholder perspective, now it is emerging that by collaborative planning and integration, there is potential of increasing mass drug administration of the lymphatic filariasis coverage that is essential for eliminating lymphatic filariasis problem. The second is local level health workers and female community health volunteers could be mobilized by incorporating short orientation about the integrated package and support. The logistic management is complex, and the third question, when and how collaborative micro planning will be utilized, is we envisage to implement micro planning in the implementation phase, and it has been done during the interaction session with the health workers and female community health volunteers, and that session we use for identify ways to improve coverage of both campaigns. Second. And we have 4 sets of stakeholders. One is within the health system, that is epidemiology and disease control division, which is running the lymphatic filariasis elimination campaign. The next is family welfare division. It is running the vitamin A supplementation campaign, vitamin A supplementation and deworming campaign. The another is logistic management division. This is a cross-cutting cross-cutting division and providing logistic support for the health program. The next is local level government within this federal system, that is federal level, province, and municipality. At university partners at communities, health workers, female community health volunteers, and finally stakeholders in the community as they are consumer and target population by health program. And the other is the socio-economic disadvantaged populations such as minority castes like Potter, Fisher, Muslims and Dalits. Recently, we have finished implementation phase, and we found in the study site that Potter, called Kumal in Nepali language, the people living in the settlement, Kumal settlement, was found to be highly at risk of lymphatic filariasis and called it red zone. So within the background, we answer enabling and hindering factors for collaboration of these two campuses. One is convincing policy as guided integration. Second is potentially increment of MDA coverage for lymphatic filariasis, and by collaboration, there is no disadvantage to the vitamin A supplementation campaign. And finally, another enabling factor is both campaign mobilize large number of female community health volunteers to reach target population. And hindering factors, we identify these two campaigns run two different program divisions, running campaign particularly over years. And the other is difference in the target population, except year 2 to 5. The subgroup is in both campaign, rest is different. And third is complex logistic management, since in the lymphatic filariasis elimination campaigns provide diethyl carbon citrate and albendazole, while in the vitamin A campaign, vitamin A supplement campaign, vitamin A and deworming capsule, deworming tablet. And within each program, each campaign, the dose varies by age groups. So within the context, we envisage and applied approaches to foster collaboration based upon the enablers and address challenge. We have recently completed the implementation phase in the study site and done micro-planning. In the one-day interaction session, micro-planning was done amongst the health workers, and the focus was on increasing coverage of the board programs through programs. Second is communication. It planned to increase integration by micro-planning and through the communication. That's local level implement, jointly sharing information, follow-up of medicine intake and side effects. For those missed medication, follow-up during the forthcoming vitamin A campaign, and reinforcing foregoing health hazards for taking missed medication. The third was monitoring and evaluation. Stakeholder assessing both campaign activity while they are doing the supervision and monitoring. And in evaluation phase, comparing coverage of both programs with the baseline coverage. Next page, please. So here is the two pictures. One is the boy is taking medication. This is last year campaign photograph from the last year campaign, and this is for the ALF medication, ALF campaign, and the next one is the female community health volunteers administering vitamin A capsule to the children, and there are even the children and mothers are eagerly waiting for the medication.